Hey, this is Dr. Dino Pappas. This is a Pain to Performance vlog. This vlog is going to be about the thoracic spine and thoracic spine mobility. The views in this vlog are my views and my views alone. They don't represent the views of any entity or agency that I may have a relationship with. I want to talk about the thoracic spine. Thoracic spine is the area where the low back transitions into the mid back and where the mid back transitions up to the neck. So basically from this bump, this base right through here, to this area right through here is the thoracic spine, that mid back. This area is an area that creates a lot of mischief. Problems with restriction of movement and motion can lead to low back pain, can lead to neck pain, can also lead to mid back pain. It's also implicated in pain and discomfort in the shoulder because you need a certain amount of extension of these joints to extend for the overhead athletes as well. Thoracic spine rotation, loss of rotation is important in our golfers and also important in our baseball players that require a certain amount of rotation, not only from the hips, but also from the mid-back as well. So again, this area is implicated in a player in a lot of different areas of the body and a lot of pain and dysfunction syndromes and loss of performance as well. So we're going to give you 5 exercises plus 1 bonus exercise for thoracic spine. The most common thing that we find is loss of thoracic spine extension. That's this area of the body rocking into extension. So several of these guys are geared towards extension or extension and rotation, which is a couple of movement. So the first one is a thoracic press up. And you may have seen the McKenzie exercises or a low back extension or the cobra pose where somebody's pushing their body upright. The variation and the progression to get a little bit more of that thoracic spine is to put the hands up a little bit higher up, so above the head level. Press your body up and look up towards the ceiling at the top. And as you do this, you're going to be generating a little bit more thoracic extension versus lumbar extension here. So this is the thoracic bias press up. Again, generated extension and looking all the way up. You can add some breathing into the end of the motion. Breathe in, all the way up. And as you generate that breath, you sag down a little bit more into extension. So that's a way of making a simple cobra exercise or a press up a little bit more effective for the thoracic spine. The second one is working the mid to upper thoracic spine. So from here to approximately about here. This exercise is intended to be for the neck, but if we take it off the edge of the table and use the table as a fulcrum and rock off the edge of the bench, we're able to generate a little bit more upper thoracic extension. So the exercise is this. You come closer to the edge as far as you can tolerate. My shoulder blades are actually off the edge of the bench. I'm bringing my neck into retraction here, bringing it into extension off the edge of the bench. I'm cupping it with one hand, bringing my head back to neutral. That's an important part. The table is fulcruming. It's acting like a little bit of a fulcrum and pushing into my thoracic spine. So when I do this, it's mobilizing a little bit more into extension from the mid-thoracic spine on up. Just be careful with that exercise, that patience, if you're a patient watching this, that you're not dizzy or woozy or nauseous or feel like you're going to vomit. Those would be reasons to stop the exercise, all right? So let's talk about a simple or good tried and true thoracic foam roll. This is just a general mobility exercise for the thoracic spine. Again, rolling from that mid shoulder blade area to that bump at the base of the neck where the junction is. I like to cup my hands like this, support my head so my head's neutral, lift on up, and just a general roll all the way to that bump right here where the neck transitions into the upper thoracic spine and rolling just below the shoulders. You may hear a little bit of a snap or a pop, sometimes I do. Those are the joints mobilizing potentially over the foam roll as well. So this is just a real simple way of gaining thoracic mobility. The next one here is one I often prescribe at work because people are mostly sitting or sedentary at work, especially nowadays with the coronavirus crisis. We got a lot more people working from the home. So we're going to use the edge of the bench here like a fulcrum, and we're just going to rock repeatedly over the edge of the bench to generate mid to upper thoracic motion. So I'm leaning over the edge of my table, or if you have a desk chair that has a backing, a lower backing, and I'm just rocking into extension over and over and over again, generating more and more and more motion, right into that area of generating extension. If you cup the hands back behind your head versus crossing this over, you're also going to get an upper pec stretch, which is good for our office workers that are in this position that are tight through their pecs. So I like the hand behind the head variation. We call it the prisoner position, where your hands are up behind your head and then rocking back here to generate that extension of that area. The last one is a rotational exercise. It's a 4-point. This can be done for the upper thoracic spine or the lower thoracic spine, depending on the hand position. With the hands here in the 4-point position, hand back behind the head, I like pushing with the opposite side. So I will push with my right to get a little bit of scapular engagement, getting those muscles of the shoulder blade on the right side engaged. This acts as a brace to activate the core on one side so that you can successfully generate rotation. So I'll push, scapular activation of the core complex, and then I'll rotate. Some people will just rotate from this position. I actively like doing this here, again, scapular and core engagement first, and then generating rotation on the opposite side. All right. To get a little bit of a different bias, you come down a little bit lower from this position, push with your elbow, and then rotate. And as you can tell, my mid to upper thoracic spine is a little bit more blocked in rotation than my lower thoracic spine, where I'm able to get a little bit more motion out of there. Another cue with the exercise is let your head go with the torso. Where the head goes, the body wants to follow. So you can use your eyes to cue a ceiling tile and then find that ceiling tile to generate more and more rotation. The bonus exercise for rotation, because I did this a lot for extension and flexion in this video, would be something called a page turner exercise. And with a page turner exercise, somebody's on their side. I usually put a pillow underneath the knee. I keep the hands up and I have them rotate into the resistance, kind of like you're turning a page of a book, rotate down into the resistance. The wall's blocking me here, but again, you go into rotation as much as possible. Page turner, rotation. This is extension and rotation. All right, so those are 5. Check that. That's 6 exercises now for thoracic spine, flexion, extension, bias, a little bit of rotation as well. I'm Dr. Dino Pappas. This is a Pain to Performance vlog.